Hey, what's up everybody? Welcome to my YouTube channel. In case you don't know me, I am Dr. Allie. I am an OBGYN, and here on my YouTube channel, I talk about all things women's health, pregnancy, periods. I also share a little bit about my personal life. I make vlog videos, day in the life videos. You follow me around at the hospital. That's a little bit about my channel. Today's video I'm super excited about because this is one of the most common questions that I get in my DMs, on my TikTok videos, and anytime I talk about Pap smears, so many people have questions. So specifically on today's video, I'm not gonna be talking about the process of getting a Pap smear, but rather the results. Because I think a lot of people go get their Pap smears and then they get a phone call from their provider, or maybe it's a nurse that's calling them, giving them the results or telling them that it was abnormal and that they need to retest in a year or they need biopsies. And I can understand how that can be very confusing, and it can actually cause some stress or worry because you don't know what it means to have an abnormal Pap smear. So in today's video, I'm going to explain exactly what all of the results mean, proper follow-up, all that good stuff. Here's a quick reminder that this video is not going to specifically be medical advice to one person. I'm going to talk about all of the general broad results that we can get in Pap smears. I get a lot of DMs and a lot of questions on women asking me to interpret the results, telling them if what their doctor's saying is true. They send pictures, they send images and lab values and all of that stuff. Here's a reminder of not to do that. One, this is not medical advice. You are not my patient. I can't physically do a physical exam, and I don't know your history or any of that stuff. So those type of questions I can't answer. But like I mentioned before, I am going to give a generalized overview. So hopefully if you were to get one of these results, you at least know what it means. Also, just like general rule of thumb, like don't send people that you don't know, or anyone really, on social media pictures that are personal and private. Did we not learn anything from sending nudes and not doing that, and how that's not okay? This is in that same territory. So make sure any of this information that you're sharing with your provider personally. And if you ever have any questions about your own personal health, results, stuff like that, it's best to just reach out to your provider and ask them to explain. Before we get started with the video, if you guys aren't subscribed to my YouTube channel, I hope that you will hit that red subscribe button and become part of this little family. I would love for you guys to join this community so that we can continue to educate and empower and just make you feel more comfortable with your health and your life. All right, so without further ado, let's jump into the video. All right, so let's start with some background on the Pap smear itself. Why do we do Pap smears? Pap smears are a way to screen for cervical cancer. It is not testing for STDs, it's not testing for vaginal infections, but it is testing for cervical cancer. Now I brought some speculums here because I'm sure we're all familiar with these. Speculums is a device that we use to do the pelvic exam in order to help us get the Pap smear. Speculums, as you can tell here, they all come in different sizes, and these are just 3 of them. There are more sizes, and some of them may be metal, some of them may be plastic, like these ones. It just depends what your doctor has at their office. So with a Pap smear, we do a pelvic exam where that speculum is placed inside of the vagina, gently opened so that we can get to your cervix, and then with what's called a cyto brush. It honestly looks like a little spoolie brush, which we use to like do our makeup. That little brush we can place up to the cervix, gently with a little brush kind of get some of the cells of the cervix. Take out the brush, it goes in a little container, and we send that specimen off to the lab so that they can look at the cells of the cervix. Once that specimen is sent in the lab, they can actually look at the cells under a microscope to make sure that the cells look normal and that they don't look different. So when we do Pap smears, we're essentially able to test for 2 different things, and this is going to depend on your age. So one, they're gonna look at the cells of your cervix. Do the cells look normal? Are there some changes? Is there a tumor? Are there precancerous cells? What do the cells look like? How big is the nucleus? This is all information that the pathologist can view under the microscope and evaluate your cells. The second part of the testing, if appropriate, depending on a patient's age and history, we can also test for the presence of HPV. HPV is human papillomavirus. We know that HPV is the main cause of cervical cancer. So HPV, the virus, can start to cause changes within the cells of the cervix that then ultimately those changes can turn into cancer. So we have the ability to test for HPV when we do a Pap smear. Now keep in mind that with HPV, it's just not one type of virus. Think of it in this way. Nowadays, we're really familiar with COVID, right? We had that first strain, we had Delta, we have Omicron now, and we're probably gonna have different strains. That's what viruses do. Viruses can change, mutate, and become different strains. So this isn't any different with HPV. We know that there's a ton of different strains of HPV. Some of those strains of HPV, we know that they're high-risk types. These high-risk type of HPV can cause cervical cancer. Then we have low-risk strains of HPV that cause things like genital warts, and genital warts does not cause cancer. It does cause genital warts, but it's not going to cause that cervical cancer. So when we test for the presence of HPV, we're able to actually test to see what strain is it. Is it a high-risk strain, or is it one that's low risk and not likely to cause cancer? Science is really cool, and it's amazing that we have the ability to be able to test for specific strains. So for example, HPV type 6 and 11, those are gonna be the two strains that cause genital warts. And then you have strains like HPV 16 and 18, which are the highest risk for causing cervical cancer. Then there's other subtypes like HPV 45, which it's a higher risk, not quite as high as HPV 16 and 18, but there have been cases of cervical cancer linked to HPV 45. Again, there's hundreds of these strains, so it's really cool that we're able to isolate and figure out which ones we worry about more than others. So like I mentioned earlier, your age plays a lot into what type of Pap smear we order. Are we gonna test for HPV? Do we just look at the cells? So let's talk about age. The recommended age to start your Pap smears is going to be at age 21. And this might be shocking for some people because for many, many years, there was a recommendation for women to get their first Pap smear right after they first started having sex. Now this is an outdated way of thinking, and your doctor should never be doing a Pap smear in someone who is younger than 21. Now the reason we can wait until the age of 21 to start Pap smears is because we know that even if people start having sex at a younger age and they were to get HPV, when you're young and healthy, you are more likely to fight off that HPV infection without us doing anything. So yeah, you heard that right. Just because you have HPV, it doesn't mean that you're always going to have this HPV. A lot of the types of HPV, our own immune system and our own body can fight off that infection. So after doing a lot of research, they found out that even if you're very young, say you had sex for the first time when you were 15, you got a Pap smear and it was HPV positive, if you were to repeat that Pap smear in a year, that HPV would be gone. So because of that, the new recommendations say just wait until a woman is 21 years of age and we can start doing her Pap smears then, because testing any earlier than that, we know that they're more likely to fight off that infection, so there's no point to test. Now, there are other subtypes of HPV that are going to be harder to fight off. For example, like I mentioned earlier, the subtypes that cause genital warts, those are going to be more difficult for your immune system to fight off. So typically a diagnosis of genital warts is something that's going to linger and stay in your body, rather than the other subtypes of HPV are going to be easier to fight off. Now, guidelines on when to start Pap smears, generalized 21. If you have some sort of medical condition like HIV, or maybe you're severely immunocompromised, have different risk factors or anything like that, then you may be in the subcategory of people that get Pap smears early. But again, it's gonna depend on each individual patient, what their past medical history is and stuff like that. So a good rule of thumb is starting at the age of 21, you get your first Pap smear. All right, so moving on, you're 21, you're getting your first Pap smear. Now, do we test that patient for HPV? The answer is no. So like I mentioned before, we know that younger, healthy women are able to fight off this HPV infection. When we get a Pap smear at age 21, we typically only look at the cells of the cervix. This is what's called cytology. So we look at the cells of the cervix and see if they look abnormal, precancer, or anything like that. There's no need to test for HPV because a lot of women at 21 are positive for HPV, and we know that because they're young and healthy, they're able to fight off that infection. One thing to keep in mind is that if you are a smoker, it's harder to fight off infections if you smoke. So if you are smoking, it would be a good idea just for your overall health to stop smoking, because if you were to get HPV, your body has a very hard time killing off that virus. So anyone who tests positive for it, I always encourage them to stop smoking. Okay, so you're 21, you got your Pap smear, you get the results of the cytology or the cells of the cervix, and they look normal. When do we need to repeat your next one? So if your cells were completely normal, you're 21 years old, and there's no issues, you can safely wait 3 years before getting tested again. Now say you're 21, you got your Pap smears, you get the results of the cells of your cervix, and they look concerning. There may be some presence of precancer, or maybe the cells have started to change and your doctor's concerned. Depending on those results, you may need to come back to repeat the Pap smear in a year, or maybe you need to go in to get some biopsies. This is all going to depend patient to patient. So while yes, 2 women may both get the Pap smear on the same day at the age of 21, one might be able to wait 3 years to repeat it, and one may need to repeat it in a year. So make sure that you're talking about this with your doctor so you know when exactly to come back. Now I'm quickly gonna go over the guidelines in a woman that is over the age of 30, because like I mentioned, all of the workup and frequency of Pap smears is pretty dependent on a woman's age and her history. So in women who are over the age of 30, you have 2 options. One, you can continue to only test the cells of the cervix, and if they continue to look normal, you can just repeat Pap smears every 3 years with cytology, or by looking at the cells only. Your other option over the age of 30 is to get 2 things. You look at the cells of the cervix, so you get cytology, and you also test for the presence of HPV. If both of those are negative, meaning HPV is negative and the cells of the cervix look normal, then we can wait 5 years before repeating your next Pap. Now we know that we can safely do this because we know that the main reason women get cervical cancer is HPV. So if there's no HPV, then we're not likely to get cervical cancer. Okay, I hope that made sense. Now let's actually talk about the results. So these are the things where your doctor or a nurse may call you and tell you, hey, the results came back abnormal, this is what it was, this is what it means. I'm gonna break it down for you guys because we use a lot of acronyms in this field of OBGYNs, so it may be confusing the terminology that we use and what we consider high risk and what we don't consider high risk. So I'm gonna start explaining the results from the least concerning to the most concerning. All right, so the first result that you could potentially get on the cytology of a Pap smear is something called Ascus. This is an acronym for atypical squamous cells of undetermined significance. This is one of the most craziest and obnoxious, I think, acronyms that there is in medicine, but it is what it is. This is going to be the most common Pap smear result, Ascus, atypical squamous cells of undetermined significance. So atypical squamous, this is referring to the actual cells of the cervix. So squamous is the type of cell and it can be found inside of the cervix. Atypical means they look different. They don't look normal. They don't look typical. So usually the results of Ascus on a Pap smear can mean a lot of different things. Most of the changes in the cells or the atypical things that we're seeing on the cells are very minimal. They're not extremely concerning. The cells just look slightly off. And typically this is due to HPV infection, but it can certainly be caused by other infections that you may be having at that time. But the infection is not that strong because the cells themselves don't look that abnormal. We see this type of Pap smear a lot. Now, depending on your age, again, if you're 21 or maybe you're 35, your follow-up may be different. But again, this is going to be the most common Pap smear that we see and typically not something to really worry about. All right, so if we continue on, the next type of cytology result that you can see, the acronym is LSIL, and this stands for a low-grade intraepithelial lesion. Again, a mouthful, it's just easier to say LSIL. So this is what's called a low-grade lesion. So I'm going to show you pictures here of what normal healthy cells look like on the cervix versus someone who has LSIL. If you really look at the pictures, you can start to see those slight changes in the shape of the cells and the darkening of the cells. Again, it's not everywhere on the cell, but you can see that there is a difference between the two. Again, this type of lesion is typically caused by HPV, and depending on how old you are, you may need closer follow-up. So someone who's over the age of 30 and gets an LSIL positive HPV Pap smears, at that point, it would be recommended to proceed with a colposcopy so that we could look at the cervix better and potentially get some biopsies. Don't worry, I'm gonna explain colposcopies afterward. All right, so the next type of Pap smear result you can get is what's called Hcell, and this is going to be a high-grade intraepithelial lesion. Now, in comparison to the low-grade one, as I'm sure you can tell, high-grade is going to be something that's more concerning. Again, here's a picture of a normal Pap smear result versus one that's Hcell. You can really see in these pictures that there's a pretty significant difference with the cells of the cervix. They look darker, they're clumped closer together, and you can clearly see that something's going on here. With an Hcell Pap smear result, it's usually always going to be linked to precancer or cancerous cells of the cervix, so it's extremely important to follow up closely with your provider if you get this result. Another type of result you can get is something called Ascus. This is atypical squamous cells, cannot rule out Hcell. So the cells themselves look abnormal. We can't really tell, is this Hcell or that high-grade lesion? Is something else going on? But it's definitely something that warrants closer follow-up. Another result that you can get is atypical glandular cells. So this is a different type of cell. So I've been saying squamous throughout this entire video. Glandular cells are cells that are found more on the inside, deeper inside of the cervix and the uterus. So occasionally, if these glandular cells are appearing on the surface of the cervix, there's something going on because those cells are typically found inside and not out. So this can be concerning again for precancer or cancer because those cells typically aren't found on the surface of the cervix. So I know that seems like a lot of information, but I hope I was able to kind of clearly go over all of the different types of results that we can see. Now, like I mentioned, depending on these results, some of them are going to be more concerning than others. Obviously, the high-grade lesions or the precancerous lesions need attention quickly so that we can prevent any sort of cancer from forming, or if it is cancer, that we can start treatment quickly. So what does that follow-up look like? I know I mentioned colposcopy, so let's quickly go over what that means. So essentially, like I've been saying this entire video, this is going to depend on your age, your history, and the results of your Pap smear. But say you're at a point where maybe you got an Hcell Pap and there's a concern that there may be some sort of precancerous lesion on your cervix. The next thing is to do what's called a colposcopy. This is a procedure that's done in the office of your OBGYN where we can take a closer look at your cervix. We're able to use what's called a colposcope. I like to describe it as almost like a microscope where we can really zoom in and look at your cervix and check and make sure that there's no obvious tumor or lesion on your cervix. This also gives us the ability to take biopsies if we need to. So if there's something abnormal or changes that look different, we're able to biopsy that tissue, send that tissue off to the lab, and they're able to tell us, hey, this is precancer or this is cancer or whatever it is that they find. If you guys want more info on how exactly we do a colposcopy and what that means, let me know and I can film that video for you. Now the next steps would be that say you get your colposcopy, it comes back abnormal, meaning the biopsy was concerning for precancer or anything like that. The next step would be what's called an excisional procedure. This would be something done to completely remove those cells of the cervix and stop that cancer or those abnormal cells from spreading. This could be things like a LEEP procedure, a cold knife cone, or maybe even cryotherapy. Now, I can film a video just talking about those if you guys want more information on those, but essentially, I just wanted to give you an overview of what next steps look like if you were to get an abnormal Pap smear. All right, so that brings us to the end of the video. I know this one was a little bit heavier and jam-packed with a lot of medical information, but I hope it made sense and I hope it kind of made you more at ease and empowers you, gives you more information on exactly what your Pap smear results mean and why we order them the way that we do. and also explains why maybe even if you and your friend started getting Pap smears at the same time, why maybe she's getting tested more frequently or you are, or the follow-up looks different. It's because it really is something very personalized and every patient is gonna have a different follow-up plan. All right, you guys, if you liked this video, please let me know by giving me a thumbs up. Let me know in the comments if you want me to film any new topics. Thank you guys so much for the support. It truly means so much to me. Any new topic ideas, just let me know and I'll get them filmed for you. If you haven't subscribed already, I would love it if you would hit that little subscribe button and become part of this family. I'm gonna leave link down below all of my social media, TikTok, Instagram, my blog. Oh, and I forgot to mention, I do have an entire blog post that I wrote about Pap smear results. So if maybe watching a video isn't your thing, but you'd rather read about it, it's a pretty short blog post, but you can definitely check it out to get more info. And remember that all of my blog posts are gonna be written in both Spanish and in English. All right, you guys, I hope you have an amazing week. Thank you so much for sitting with me and talking with me today. I hope you learned something new today. Always remember to be kind and show love to everyone around you. I love you guys so much. Have a good one.